Hi, my name is Lily Caldwell, and I'm going to be talking about and introducing the topic and condition of diverticulitis. Diverticulitis, if you don't know, it's just where little pockets of diverticuli are in the lining of the large intestine and colon, and it could result in death by a perforated bowel, which is just the rupture of the colon, basically, and it can be very life-threatening. Many people in the United States are affected by diverticulitis. Many people, actually 75% of people over 80 have diverticulitis. So it is mostly the elderly population that have this condition, and it is a common condition for people to have as you get older, because as we get older, the colon becomes more weaker, and that's what causes the diverticuli pockets to occur in the colon. The signs and symptoms of diverticulitis would be abdominal pain, cramping, swelling. Those are the most common ones just because the large intestine and colon, they are in the abdominal area of our stomach. So that is the most common ones, and also that causes nausea. So nausea is another one, and also a fever. You can get a fever with diverticulitis. Like I said, the little pockets in the intestine, they can cause inflammation or infection. So that can then cause you to have a fever because of the infection, and it could help the doctors to determine what you have as well, because if they see that you have a fever, they may be like, hey, this person has a fever, we need to get her on treatment as soon as possible, and it could actually help them to indicate that you do have diverticulitis. But those are the most important ones to look for, because they could indicate a flare-up of diverticulitis, which you would need to go get looked at. The causes of diverticulitis are these little pockets in your large intestine, which then could become infected or inflamed, and it could become a perforated bowel, which is basically just the rupture of the colon, and that can be very life-threatening, because what that means is that you basically just have feces leaking out of the colon into the abdominal cavity, and that can be very serious and can cause sepsis. So you will want to go get that checked out as soon as possible and be under treatment as soon as possible too. But there are many diagnostic testings that you can get done for diverticulitis. One of them being the most popular one, the CT scan of the abdominal area and pelvic area. This can just kind of determine, the swelling and the bloating part, and kind of see what's causing the pain for you. Also, a colonoscopy is another one. This is just where they take a scope and see the internal side of the colon, kind of see, what's going on, like a pileup, and look at those little pockets to determine what probably caused the diverticuli flare-up. Also, blood and urine test can be helpful, because, like I said, with the little pockets, they can get inflamed or infected, and with infection, you can see that with blood or a urine test because of the white blood count cells. So they look at that most of the time. And also, if a woman comes in and she has diverticuli symptoms, then sometimes they'll give her a pregnancy test just to kind of rule out the abdominal pain, and they can then say, this person isn't pregnant, we can rule out the abdominal pain, and it's something more serious, and it could possibly be diverticulitis, which they would then undergo treatment for. But speaking of treatment, you can have lots of treatments with diverticulitis. One of them in general is just resting. Us as humans, we need rest to, just to feel better sometimes, just to take stress away. But with diverticulitis, it's so serious and you go through so much pain that resting is very important, just to give your body time to heal. Also, treatment such as antibiotics are very helpful. I know that Cipro and Flagyl are two of the most common ones that people or doctors use for diverticulitis. It can just take the infection away, help the swelling, and cause the flare-up to go away, temporarily at least. But also, hospital care is very important. when you have diverticulitis because you want to get the proper treatment that you need. And it's very important that you do so because it is a life-threatening disease, like I've said many times. Surgery is another one while you're in the hospital. You could have to undergo surgery, and that would just be where they might take part of the colon off that has the diverticuli, the part that is really affecting you the most or really isn't getting better. You might be coming into the hospital every few weeks with a diverticulitis flare-up. That's where they would then want to go and remove part of your colon that's attacking you the most. And this could indicate a colonoscopy bag too, which it really just depends on how much of the colon that they take off. But it could be temporary or it could be a permanent colonoscopy bag, like I said, depending on how much of the colon they had to take away. Another thing is diet. You have to really watch your diet when you have diverticulitis, just because of the things that you eat. I know that most of the time doctors prefer for you to stay away from nuts or seeds, popcorn, because of the popcorn kernels, and even corn, just because these things our bodies don't really digest very well. And so whenever we consume those, we don't digest it, and it could get stuck in those little pockets of the diverticulitis, and it could then cause a flare-up immediately. I do know that doctors recommend that you have a diet of high fiber because that can harden your feces, and with softer feces it could also get stuck in the pockets and become inflamed or infected and cause another flare-up. Also, clear liquids are good, such as tea and water and broth. That can help a lot as well. There can be a long recovery time for diverticulitis, just depending on if you have an acute or a severe case of it. I know that, like I said before, if you have to have surgery, you would then have a longer recovery time. And, if you come in and, they just get to give you antibiotics and you're good to go home and that helped the flare up, then that would be more of an acute case, whereas these people that are coming in every few weeks with diverticulitis and have to undergo surgery, that would be more of a severe case. But it also is a chronic condition, and so sometimes it can be managed your whole life, just because you have to watch what you eat and you have to watch your diet. And it really just depends on how healthy the person is as well. If you have other chronic conditions with it, it can just build up on top of it, so you might have a longer recovery time. But this overall is a life-threatening condition, and I think it's important for us as humans to be aware of the side effects, and that's one of the first things that you notice and you need to look for, is the side effects and symptoms, because it could indicate a flare-up of diverticulitis. But it's important for us to be aware of these symptoms and realize how serious this condition is and how it affects many people in the United States, especially the elderly population. But thank you for listening, and I hope you have a great day.